Well, what is currently trending everywhere is artificial intelligence, and we don't want to miss out on that. Inviting Dr. Sindhu NM, Associate Professor, Government Medical College, Ernakulam, for a talk on the same.
Good morning, everybody. I'm Dr. Sindhu NM. I'm going to talk on artificial intelligence in diabetic retinopathy, exploring AI's role in early detection and treatment. According to ICMR India Diabetes Study published in 2023, the prevalence of diabetes in India is 10 crores. And according to the Smart India study, the study found that prevalence of diabetic retinopathy is 12.5% and with 4% having severe diabetic retinopathy. So, what are the challenges in diagnosis of diabetic retinopathy? A regular and repetitive annual retinal screening in all patients with diabetes mellitus is needed, which includes a detailed dilated fundus examination done by an ophthalmologist and with color fundus photography taken by a technician or optometrist, which has to be analyzed and graded by retinal specialist or ophthalmologist according to ETDRS grading guidelines. So, the number of doctors, number of ophthalmologists or retinal surgeons in comparison with the patient load is very less, and there is limited access to specialized care, especially in remote areas, and the high cost of eye exams and subjectivity and human error in interpreting the images are the major challenges. So, why AI? The screening itself helps in avoiding blindness among 90% of patients with diabetic retinopathy. So, providing an automated imaging system within the easy reach of the patient and developing automated analysis software using computer machine learning or artificial intelligence for analysis of retinal images in patients with diabetes itself will solve some part of the problem. What is artificial intelligence? Artificial intelligence is a simulation of human intelligence processed by software or machines, especially computer systems. In simple words, it means to accomplish a task mainly by a computer or a robot with minimal involvement of human beings. The types of AI includes machine learning, deep learning, and neural networks. Machine learning algorithm identifies patterns in data and make predictions based on those patterns, whereas deep learning is a subfield of machine learning which is particularly effective at learning from large amount of unstructured data like images, text, or audio. All the AI system needs a proper training and validation. The AI system start by learning from a database with the simple targets. After this, they are trained to improve, becoming more accurate and efficient. This is done by bombarding the AI software cloud with a large amount of data, and they learn to identify from seeing the pictures, and by improving training after training, the validation process done. Using advanced math and neural network, the system can understand complex relationship between variables and evaluate different possible outcomes. So in diabetic retinopathy, firstly, the machine after being exposed to a lot of annotated images learns to identify and grade diabetic retinopathy by itself. The software can automatically analyze retinal images and provide the grade and severity of diabetic retinopathy and referral recommendations. So in the clinic, when a patient comes to you with the diabetic retinopathy, the technician can take a fundus photograph, and these fundus clinical photographs are uploaded into the AI software cloud, where this software itself identifies diabetic retinopathy and classifies and grades and whether it is referable or non-referable, or with diabetic macular edema or not. And this diagnosis we can it's sent to the clinician sitting in the clinic. The clinician can provide a counseling regarding the condition of the patient, or if needed, refer to the higher center. So the effort or manpower taken will be very less than the routine examination done by an ophthalmologist. What are the techniques used in diabetic retinopathy diagnosis? It's AI-based systems that detect retinal images using standard 2D images, or AI algorithms assess the OCT scans for retinal thickness and structure changes, or AI-driven software helps in automated screening, improving the efficiency in large-scale screening programs. The advantages of AI in diabetic retinopathy includes early detection, accuracy and consistency in getting the results, and the cost effectiveness and scalability. The case studies and real-world applications, and IDX-DR is the first FDA-approved AI system for detecting and grading diabetic retinopathy. And Selena is a Singapore eye lesion analyzer. It's used in their national program of Singapore for grading diabetic retinopathy. And Arvind, in India, Arvind Eye Care System already started AI system along with telemedicine for screening diabetic retinopathy in underserved regions. So in addition to diagnosis and screening, AI is useful in staging and classification, lesion analysis, functional assessment, personalized treatment planning, and progression prediction. The challenges in AI in diabetic screening includes the need of high sensitivity to sight-threatening diseases, the high specificity to limit the false positive referrals, and a good data quality is used for validation and training. Generalization into the diverse population are still under struggle. Regulation and ethics regarding the patient private data privacy, and integrating the health with the existing healthcare system is another challenge. The future directions, the ongoing advancement in AI and deep learning models will improve the accuracy and diagnostic capabilities. Integrating with telemedicine and AI can provide a personalized treatment plan depending on the patient data. To conclude, AI is offering a more accurate, cost-effective, and accessible care. Early detection through AI can prevent vision loss and improve the patient outcomes. The future advancement in AI will continue to enhance the healthcare for diabetic retinopathy patients globally. Thank you for your patient listening.